Hello, everyone. Thank you for joining us. It's so great to see so many people attend this panel discussion, Planning During and After the COVID-19 Pandemic. I'm Renia Ehrenfloyd, and I'm the chair of the ACSP Committee on the Academy, and this is one of a few webinars we're planning on doing this spring and in the fall. Our speakers today are Marisa Zapata, Portland State University, Laura Harjo, the University of New Mexico, Jeffrey Lowe, Texas Southern University, Samina Raja from University at Buffalo, Shannon Van Zandt from Texas A&M University, and Rob Olshansky, the University of Illinois, Urbana-Champaign. Each person is going to talk for 5 to 10 minutes, and then we'll take some questions. You can put the questions in the chat. So Marisa Zapata will be our first speaker.
Justice seriously, then what we really want to be thinking about is the people who are most marginalized and vulnerable, and recognizing that things were not good or great for those individuals before this happened. When we do futures planning, particularly if we're looking at the large aggregate models, we focus on those aggregates. We don't focus on minoritized populations by definition. And so I really want to push people to start thinking about focusing on the disaggregation, focusing on our worst off populations as the point of origin for futures planning. It doesn't really matter how I make out in the next futures, right? You want me to be doing okay, because it would be bad if we get to the point that all the professors are also doing terribly. But what really matters is how the person who is living in deep housing insecurity or is houseless, has lost their job, and will never be able to go back to the restaurant that they were working at will actually do. And so I think this shifts us from just thinking about how we collaborate to focusing on an equity-driven perspective. Right, and so we're thinking about how do we collaborate, how do we create collective will and action for the people who are worst off. Those should be the people that we're really, really driven to focus on. And that is something that we don't do in current planning practice. If you look across our planning listservs right now, we're largely absent from these kind of conversations. We have a moment to really think about the fact that there is serious disparate impact happening. And I'm really surprised how often I present to planning academics and practicing planners about disparities around the economy and homelessness, and people are surprised. Well, there should be no surprises that the infection of COVID is having a disparate impact on Blacks and Latinos. We're seeing higher case rates, higher death rates. There shouldn't be a surprise that economically those communities are being affected more because they tend to be in lower wage jobs to start with. They have fewer cash reserves. They're more likely to be in situations of exploitive landlord practices, right? And so all disaster will do is make those things worse. And so I really think that our chance is to instead say, what does a future look like in which we are in fact actually planning for those populations? I'm going to give 2 quick examples of what that might look like based on my research and practice experience. I do a lot of work around participatory planning, and I've already heard my students saying, well, this is great. Now we're like all well-versed in technology, engagement, and we can just do that forever. And I'm having to really push back and say, well, first of all, is our engagement about data collection? Because sure, electronic opportunities may actually be able to help us really get great data. But if our engagement practices are about power building, power sharing, community development, helping people become community planners, nothing will augment or change face-to-face interaction and face-to-face dialogue. In practice, we're having to really think about what's going to happen next year with our big planning workshop, right? We have a 2-quarter sequence. We're on the quarter system, y'all. For all academics out there who are like, yes, our semester's ending. We got till June 15th. So we're having to think about our 2-quarter sequence and what does it mean to either go forward with a workshop situation where students are supposed to be working with clients in practice, versus doing things online in case we end up in that situation? Who wins and who loses in that circumstance? The other question that the students are dealing with and I'm dealing with is which projects should actually go forward, right? So do we decide in this moment that true and deep and rich community engagement is in fact something that is so integral to our planning projects that we actually have to say, no bike lanes are put in right now, no neighborhood plans are written right now? And I don't know that we're actually prepared to grapple with that. The other area in which I work, I run our homelessness research center at Portland State. And if you know me from work on futures planning, you might think, how did this lady end up thinking about the most pressing societal issue we have right now? And I think that there's actually a lot that we bring and we miss as future planners in connecting to today. We're largely absent as a profession. There's obviously individuals and specializations that talk about housing affordability and housing tenant rights and justice. But if you hop on planning listservs, what are we all talking about right now, right? A lot of people are talking about how to suspend public meetings, how to deal with setbacks, right? We have a tendency to dive deeper into the things that we do. And I think that that's important, right? A lot of what we're all having to deal with as human beings is managing our own anxiety right now. But if we really want to be relevant in the present, be relevant in the future, we also have to be relevant in the present. And right now, our community members are suffering. There are people who are on the street, who are in affordable housing complexes, who lack access to food. The normal mechanisms of food access have been disrupted. There are people who need masks. There are people who need basic goods and services, people that need volunteers, people that just need you to make a phone call to call a senior, right? So those are the kind of volunteering things we can do. But what are the things that we can do as practitioners and academics to connect with people who are marginalized, understand how we can help them as researchers, as planners in this moment of crisis? We often talk about how in our futures planning and our participation and engagement, the poor people or the people of color don't come to our events, aren't represented in our activities. And this is why. If we have nothing to say as a profession, as an academy at this moment, a way of identifying our commitment to these communities now, then we will have nothing to say about what happens to them in the future. Thank you.
And now Laura Harjo. And thank you, Marisa.
Okay, thank you. Let me go ahead and share my screen. Sorry, I got a weird setup here. Okay, so thanks for having me here. I'm going to go ahead and give kind of a brief overview of some of the things that are happening in Indian country right now. And by Indian country, I mean tribes, pueblos, bands, etc. So I just wanted to start with some facts. So indigenous nations and the US government have a political relationship with one another. They've been in a political relationship, and this is forged through treaties. There are 574 nations. They call themselves tribes, bands, villages, pueblos. They are linguistically and culturally diverse. Some of the specialities that we see are reservations. So the bulk of tribal areas are reservations in the continental US. Then you have jurisdictional areas in Oklahoma, and the population is interspersed in rural and small cities. And then you have urban areas. In 2000, 67% of American Indians and Alaska Natives lived in urban areas. In 2010, 71%. So we can see that we have quite a few indigenous folks that are living in cities. So I just kind of wanted to lay out that a little bit. So what we know right now in terms of what's really coming up sharply with COVID-19 is that infrastructure is lacking, especially in terms of getting water to communities. Some communities don't have running water. Navajo Nation has the 3rd highest infection rate, which is right behind New York and New Jersey. And within Navajo Nation, epidemiology is lacking, so it's hard to trace where the cases are coming from. Medical care to indigenous communities is lacking as well. And then in terms of the CARE Act, in the news recently, there was a data breach of tribes' financial information. So you saw that there are 574 federally recognized tribes. So for the tribes that did apply for relief from the CARE Act, somebody from the Department of Treasury or Department of Interior leaked financial information. And so there's a spreadsheet circulating around DC and among lobbyists with tribes' financial information. And then in terms of food systems, a lot of these communities are rural areas, so they are doing food production, food sovereignty projects, but maybe some of them are struggling with loan relief. So the Inter-Tribal Ag Council is trying to secure relief as well for farmers and ranchers and small scale food growers. And then some of the barriers that we're seeing are definitely access to physical and mental health care. In a lot of these cases, if we look at the spatial aspect, like for example, here in Albuquerque, if you have an indigenous person living in the city of Albuquerque and they don't have insurance, which if you're a member of a federally recognized tribe and you have access to Indian Health Service facilities, you don't have to carry insurance. So if you don't have insurance, you live in Albuquerque, the closest hospital is either going to be in Santa Fe, which is about a 50-minute drive to that hospital, or to Gallup, which has, it's a bigger facility, and that's about an hour and 45 minutes. So you can see that the time that you have to spend on the road just to get to care can be a barrier. And then in some cases, transportation. I've had some of my students from Navajo Nation talk about difficulty in transportation, and in some cases giving folks rides to town and picking people up along the way, people's grandmothers hitchhiking between towns. Like, even though that there's a kinship aspect to that, I'm trying to highlight the transportation aspect of that. The lack of medical resources in terms of just masks, ventilators, healthcare workers, etc. And then the inability, or they're less able to do telemedicine because of the digital divide. And this was recently in the news. NBA player, he tested positive. He was the first in the NBA to test positive. And he has a foundation that reaches out to kids. And so he had a group of kids come out and everyone got tested that was around him, but this Native American mother couldn't get testing for her daughters, even though they were showing symptoms of fever. So this idea of medical bias in testing, whether it's race, class, etc. In this case, maybe it was the intersection of race and class, because maybe they didn't have access to adequate health care, but everyone else got tested. And I have a couple of sources on there if you want to look into that a little bit more deeply. Let's see. And then, so I kind of tie this into what Patrick Wolf calls settler elimination of the Native. So we have an ongoing legacy of the ways in which the settler state continually works to eliminate indigenous folks. Not just indigenous folks, but we can see like this kind of exceptionalist attitude and posturing around xenophobia regarding race, and like there's always an enemy that's set up. So if I go into this idea of settler elimination of the native, the legacy then is dispossession of land, displacement of population, frontier homicide, missing and murdered indigenous women, the overrepresentation of indigenous folks being incarcerated, mismanagement of our trust resources such as land, contracts, leases, lack of health care resources, extractive economies in our land that are polluting drinking water, digital divide, lack of internet infrastructure, and this recent federal data breach. So the idea of settler elimination of the native then is ongoing, and we can see it in sharper focus right now. And some of the interventions to think about right now and in the future are definitely around data sovereignty. So the IHS facilities right now, those are run by the federal government. So health data is in the hands of the federal government. And some of the hard questions then are coming up are that, you know, the relief that we're looking at is relief to a capitalist economy. So this notion of also with the individualistic ethos. So if we're looking at maybe alternative economies, what then does it look like to have small local economies with mutual aid responses? And that's sort of what, that's what I talk about in my own work, and I highlight it for Indian country. And I'm starting to see how people that are bound to their local specialities, they are responding in mutual aid ways. So then, since we're hitting pause on a capitalist economy, how can we begin to think of other sorts of economies? For tribes right now, some of them are closing the borders to their reservation. For example, Eastern Band of Cherokee Indians, they only have 120 fluent speakers left, so they're trying to protect that sort of knowledge. Delivering food and resources to tribal members here in New Mexico, like some of the pueblos here, they only have 1,000 members, so they cannot take an outbreak. So they are delivering food and resources directly to tribal members. So I know that there's relief going on for Navajo Nation. There's also relief needed for the pueblos as well. And so this sort of leads into needing indigenous case studies and planning required in a planning curriculum so that folks are better able to grapple with some of the nuances of what's happening in Indian country. And then finally, this is also part of my work as well, is looking at indigenous methodology. So how do we carry this out? And how do we carry it out with theories that are grounded in indigenous ways of knowing? So the first, I talk about radical sovereignty. It's bound up in kinship relations, not an injured notion of sovereignty that we see that the settler state calls sovereignty. And that really is around thinking of community caretaking. So we're seeing online beading circles right now. We're seeing folks delivering food, preparing seed kits for neighbors in terms of community knowledge, recognizing that there are other forms of knowledge, which this becomes very important for Indian country, because if we only have a few knowledge bearers left, it becomes important to ask questions like, is there any wisdom you wish to share with me? What does the future of the community hold, etc. And then in terms of collective power, how to move forward and start having conversations is asking people, you know, what 3 to 5 things are you proud about in your community? What 4 or 5 things are you sorry about? Identifying assets in the community. And this goes back to trying to formulate alternative economies. And then in terms of emergence geographies, how do we begin to understand place and understand community knowledge that is bound up in place? And that ties into map biographies and understanding those sorts of things. So that's what I have for now. So thank you.
Thank you, Laura. Jeffrey Lowe?
Yes. Good afternoon or good morning, depending on where you are, to everyone. And thank you for giving me an opportunity to share my perspective in terms of where we are and perhaps where we need to go with planning in the midst of this pandemic. You know, I think Marisa set us up really nicely in terms of where we may be personally in this moment. Many of us know people directly or through someone, and certainly we've heard of others who have been really affected by this pandemic. And we have, many of us are even involved in our own ways, whether it's giving to our local food pantry or engaged in pressing immediate response to communities and households. What I've been spending, I guess, I would say quite a bit of time thinking about from the aspect of planning education and its impact on practice is, you know, how do we view this as an opportunity to reset? In some ways, I think that some of the values that planners have aspired to in terms of equity and justice and inclusion, that the pandemic has, as Laura said, you know, almost placed a halt on our economy. And that has shown, at least in this moment, a greater appreciation for the values that planners have aspired to. And so how do we further push those values forth as planning educators in particular, you know, to the place where it's very clear that we need to be concerned about the well-being of people over profit, right? So I see this almost as a moment that we push that further along. Our history is pretty much, is very much, I think, even tied to this moment. Pre-planning, as we, for those of us who are engaged in planning history, has taught planning history, we know about the urban reform movement. We know that even zoning early on was really about creating healthy places. And maybe this is a moment where that history gets to resonate at a higher level and connect to where we are today. Perhaps this is a moment that we, as city builders, as those who are really involved in, you know, regulating the built environment, maybe this is a real opportunity for planners to talk about what density is, what density means, in terms of eliminating conditions, how land use comes into play, in eliminating conditions that might head or spread communicable diseases in the first place. We talk about the social determinants of health as planners. You know, we know that there are disparities when it comes to race, for example, and income. And again, this is not so surprising to us, but how do we as planners and planning educators prepare future planners to take advantage of this opportunity, I believe, to be more savvy in accentuating the values that we hold that bring us to a place where we're creating communities of greater social justice? I think that's the question. And I think the answer really is connecting that history to where we are today. And we can do that in a more conscientious way. I think it will empower. Data is important. Data is extremely important. But we also know historically, perhaps where planners have failed is that we historically haven't been persuasive enough to move decision makers beyond just looking at data and moving forward to implementing our best alternatives that bring communities, especially lower income communities of color, Black and brown and other lower income communities up to where they used to be. And I think we may be at a moment that we should take advantage of in doing so. This pandemic has certainly raised consciousness in terms of access to healthcare, but beyond just access to healthcare, I think it's illuminated lessons about how many households and communities are impacted by not being able to afford healthcare, right? Because as things presently stand, for example, here in the state of Texas and in Houston, where we have been, for the most part, at the forefront of trying to shelter in place and do other things to protect the population. The first tests to come to our area were through private means, and the average cost was $200. So, that's out of reach for many people. So I think that as we move forward with a particular focus on policy, this is an opportunity particularly from a social justice aspect, to have more community involvement as decision makers in the policy formulation process, and also thinking about ways that we develop our own knowledge to bring more attention to what we can learn from planning history in the development of new knowledge. I think Jay Pitter and the work that she's doing in Canada and Toronto, for example, is very important, where we think about forgotten densities. Her work in particular dealing with prisons, homeless shelters, and as we know, senior living facilities. So I'm going to stop right there so we can allow more time for others. But I think this is an opportunity for us.
Thank you, Jeffrey. Samina, Raja?
Thank you all for joining this conversation. I presume everybody can hear me clearly. So I am going to attempt to share my screen. Okay, I think you should be able to see it now. Even though we have gathered because of a current crisis, I feel like I'm repeating information that I've been repeating for too many years. And I apologize, I felt compelled to copy a prior title just so that we would be reminded about what we are talking about is not necessarily a new conversation. It's a conversation that food communities and food advocates have been having for a long time, and perhaps urban planners haven't necessarily been listening. So what I'm going to do quickly is to share some information, but before I do that, even though I am the one speaking, I'm really speaking on behalf of a large group of people, and I want to call them out. Some of them are on the call today. So just, this is a team that's talking about planners. So to quickly bring us to the work that I focus on, which is really around food systems. Our community's food systems have been broken for a very long time. This is no news. Black and brown communities, indigenous communities, you heard colleagues talk about this before I started speaking. These food systems have been broken for a very, very long time. Wages and benefits for workers that we depend on, farm workers, restaurant workers, grocery store workers, undocumented workers who are responsible for the food that we're talking about today, that has long been ignored. This is not new news. None of these problems are new. They have been illuminated and exacerbated by COVID, but my really important, perhaps, reminder for all of us, which I'm hearing from all the speakers, is that nothing is new here. There have been structural disparities in our communities. Unfortunately, neither our policymakers and in many, many cases, urban planners or regional planners just didn't listen. So COVID has, as I said, exacerbated and illuminated fractures in our food system. And we should all, on this call as planning educators, be concerned about the fact that food systems were never a priority for our profession. 1% of APA members in 2014 reported, these are planners who work on behalf of local and regional governments, reported that food systems was a priority for them. So I'm just going to repeat the percentage, 1%. This was a survey sent out by APA colleagues, one of whom I know is on the line today. In short, food was never a public concern, including for planners. Yet, in the face of COVID, we have found new language to describe food systems and food workers. We are now describing them as frontline workers, and we're describing food systems as essential. When Governor Cuomo in my state is being heralded as a champion of managing COVID, and he absolutely is, he's now calling grocery store workers the same way that he's calling doctors and physicians. But there was never a time when we weren't eating. There was never a time when that essential service wasn't true. So in some ways, I'm finding that this moment is revealing the hypocrisy of our governments at many, many levels, including of our local governments, including urban planners. So while policymakers and planners might have been ignoring this, community coalitions, like they always have been doing, are stepping up where policy leaders are falling short. You heard examples about Native communities that are doing this, indigenous communities that are doing this. I would suggest that, in fact, even in Buffalo, where most of my work and my lab's work is based, is doing this. Community coalitions are responding when really local governments and planners are missing in action. So in Buffalo, there is a coalition of 80+ individuals called Seeding Resilience that assembled in the wake of COVID super fast. The coalition has already been meeting for 5 or 6 weeks now, and they are purposefully focusing both on acute and long-term needs of the community with 3 very actionable goals. One is to rapidly redistribute food to Black, Brown, and refugee communities, and also increase food production in the city, and then finally increase employment opportunities. On the right side of your screen, you're looking at a map that was prepared by coalition partners. This was my lab's contribution to the effort, where we are distributing information super fast. In the wake of COVID, Seeding Resilience has launched a backyard, front yard gardening movement that is led by one of our Black leaders in the community, Gail Wells, who coincidentally is trained in planning. And she's calling it Freedom Gardens because she wants to remind that some of the traumas that our communities are experiencing are not new. They're being revealed by COVID, but they're not new. All of this work is only possible because of prior networks, informal coalitions that have existed in the city of Buffalo and in other communities as well. So what does the future mean for us as planners, educators, practitioners? If we are to aim for more equitable post-COVID food systems, for one, local, regional, and metropolitan governments across the United States will have to address deep structural problems in their own communities' food systems. They must support efforts like Seeding Resilience and other mutual aid efforts in other cities and communities. They will have to remember that food systems were always and will continue to always be an essential and public infrastructure. Federal government is likely going to continue to abdicate its responsibilities unless a miracle happens in this country. And therefore, local and regional governments and planners will have to negotiate new relationships with state governments so we can put in institutions that can respond to situations like this. We cannot do this without a central focus on equity and justice, and I think that's a running theme among all the speakers today. Fortunately, we do have examples of local governments that have been rebuilding their local food systems. I put up a link to a national project that documents this. Growing Food Connections has examples of local governments that are lifting up and recentering their local food systems. I reached out to one of those communities in preparation for this call, and Holly Freistadt, who heads City of Baltimore's Department of, well, she's in the Department of Sustainability, but she's their food policy director. She shared this note that I'm going to read out to all of you. She said the Baltimore Food Policy Initiative had created an emergency food working group, an emergency food response plan, hired a food resilience planner, and in collaboration with Hopkins had already done extensive food environment mapping. What Baltimore also did was they had established something called Resident Food Equity Councils, where residents directly inform food policy. Because of all that capacity building in the background, she and I speculate that Baltimore was better prepared to respond to COVID, and municipal governments that will think beforehand about investing in their local food systems, but with a focus on equity and justice, are more likely going to be prepared to do this going forward. It's crucial to do this in partnership with communities time and again. We, as educators, keep talking about participatory engagement, leading with community, but unfortunately, COVID reveals again and again that we don't do a good job of it. So among us, planning educators, an appropriate question might be, what's next for us? For one, let's at least try and remember that food systems, just like sidewalks, bicycle lanes, greenway planning, all the usual bread and butter zoning stuff that you all are doing in your courses, remember that food systems are a public infrastructure just as much as those other things. Let's not wait for another crisis to figure out that food systems and food workers are essential workers. Thanks.
Thank you, Samina. Shannon Van Zandt.
Hi, everybody. Let's see. Now I can share my screen, I think. If I can find the right one. So it's good to see all of you. It's nice to scroll through the names and see so many friendly names or names of friendly people that unfortunately we're not seeing face to face, but I'm really excited to have everybody here and such a great turnout for this inaugural event that the Committee on the Academy has put together. I wanted to comment or talk about COVID-19 in the context of my regular work, which focuses on social vulnerability to natural disasters. And while I had not really been thinking about a pandemic as the kind of natural disaster that fits well within the work that I do, once we're faced with that challenge, I started to really try to put it into that context and to identify what was similar to planning for natural disasters and what was different. And as I thought through it, I think there were and are a number of things that we can take from disaster planning, and particularly hazard mitigation and disaster recovery, that are going to be applicable, that are applicable today and will be going forward as we both recover from this as well as recognize it as a new threat that we will continuously be facing in the future. So those of you who are familiar with my work know that I write a lot about social vulnerability, and a lot of the speakers today have already identified many of these social vulnerability characteristics. This is not an exhaustive list, but certainly things like race, ethnicity, gender and household composition, income, age, and housing tenure are factors that we know to be very important. I left some of the other little bubbles up there to represent other factors of vulnerability, like disability or things that maybe I didn't explicitly specify, but we know to be important as well. And what we see, of course, is that these factors, these characteristics of individuals, but also neighborhoods, can lead to differences in people's ability to respond to disasters in important ways. Their capacity to respond, the way they receive and process information, the extent of power or control that they have within their communities in terms of influencing decisions, and of course their actual resources, which often we think of as being financial resources, but may also be important social resources and things like that that can help people meet the challenges that they experience both during and after a disaster. And the literature tells us that these differences can make can have disparities at every stage of disaster, from warning and evacuation through to damage and casualties, preparedness, mitigation, and recovery. And so the way that I think about social vulnerability is I try to take it a little bit past the individual level, which is more commonly addressed in the traditional disaster literature especially, and also identify these neighborhood level aspects, and recognizing that people and households do vary in their capacity to anticipate and respond to disasters. And then mostly, the most important thing that I find myself saying over and over again is that people are not randomly distributed in space. We know that, planners know that better than anybody. They're concentrated in fairly predictable spatial patterns that are based on some of those household characteristics, particularly race, ethnicity, and income. And these spatial patterns within our communities, along with the inequitable provision of affordable housing and infrastructure that go along with it, can, in my normal practice, looking at flooding. So we know that those patterns increase exposure to flooding as well as some other hazards, and that they have both short and long-term consequences for socially vulnerable populations, including threats to health and to wealth. When I first was thinking about, or some of these first maps of COVID-19 came up, it reminded me of that original John Snow dot map that Edward Tufte uses in his book, and that when we teach planning history, we often go back to as the kind of the origin of using spatial thinking and spatial mapping to identify public health threats. And then that reminded me, or I relate that to my own type of mapping that I do. And here on the far left, you see one of our social vulnerability hotspot maps layered with, I think in that case, it is surge zones. Or no, that's floodplain. I'm sorry, I have a different one for surge zones, but that's the floodplain map for the coast of Texas. Houston is the major metropolitan area that you see, and then this is Galveston Bay. And so this is the type of hotspot mapping that I do a lot of, and it reminds me of some of these hotspot maps that we have seen kind of at a national level. This one shows Louisiana and the major outbreak hotspots in New Orleans. And I looked for maps yesterday that had a smaller scale, that were really looking at the hotspots within communities, and I think we will start to see those going forward. I couldn't find any good examples yesterday, but we know that we're seeing hotspots in assisted living facilities, as Jeffrey mentioned, in food processing plants, in very dense areas where people are either living or working in close proximity to one another. And so I think for planners, it's helpful to remember that there is this spatial aspect that I think as we go forward and try to understand the pandemic better will become increasingly important in terms of how we can address it. And then, of course, as many have mentioned, we're seeing these disparate impacts. This article is one of the first articles that came out in early April, looking at how Black Chicagoans were taking a disproportionate hit from COVID-19, both in terms of cases and in terms of deaths. And while I know that there are a lot of economic factors and maybe even genetic factors that are associated with this outcome, I think that we will also find that there are neighborhood level influences that are important in this disparity, in that people of color are more likely to work and live in more dense areas, particularly overcrowded conditions. I know there's a lot of concern from planners about demonizing density, and that's a scary thought for all the work that we've tried to do to get people to live in more dense areas. But I think the key is really the overcrowded conditions and the low quality structures that people may be working or living in that can fail to inhibit the transmission of the virus and kind of contribute to those outcomes that we're seeing. And we're also we know that communities of color have poor access to open areas and green space, as well as preventative health care. And so then I started thinking about what we should be doing in our practice, and particularly for my practice and our practice here in my department with our professional program in planning. We're working with a lot of small communities, low capacity communities, both in urban and as well as in rural areas. And one of the first things that we always do is to build a fact basis. And so one of the things that I think we will be looking at, and we've already started talking about doing going forward, is to revise our vulnerability assessment tools in terms of identifying and mapping some of these probable hotspots based on overcrowding and neighborhood conditions. Certainly looking at hospital capacity and accessibility as part of critical infrastructure, which we kind of do already, but we don't often pay like super close attention to the bed capacity. And then also assessing the economic vulnerability related to sheltering in place and telecommuting, because those are things as we go into this recovery period that are going to be particularly important in terms of diversifying economies and recognizing the populations that are going to be disparately burdened by either being forced to return to work or not being able to return to work. Sorry, my dog is actually hitting my hand and not letting me click the mouse. And so finally, I think, and this is just a hot take in terms of how we might reduce our vulnerability to future pandemics, I think we will be, especially in smaller towns, looking at prioritizing economic diversity. That's certainly something that we've recognized in our disaster recovery work, is that communities that are very heavily dependent on a tourist economy or a service-based economy often really struggle with that workforce housing returning after a disaster. I think affirmatively furthering fair housing as a broad umbrella of trying to make our communities more spatially integrated and creating more affordable housing opportunities will continue to be important, and that we'll see that that's a factor in communities that recover quickly and those that don't. Attending to inequity related to stormwater management infrastructure, which may or may not be relevant to COVID-19. But it's definitely relevant to flooding. We also need to make sure that our plans are providing that social safety net related to support for labor, related to SNAP and access to food, definitely seeing that infrastructure as critically important in the job losses that we're seeing. And then of course, protecting renters from eviction. And so that's just like 5 of the things that I think we'll be doing going forward. I'm sure that we'll be identifying more as we start to actually implement this, but I wanted to leave you with those few ideas on how we might proceed. Thanks.
Thank you, Shannon. And Rob Olshansky.
Okay, I'm unmuted. Great, thank you. It's really a pleasure. It's actually a privilege to be with this group. I really, really enjoyed all the insights. I second all of those. But so what I chose to talk about today is to sort of focus my question on my area of specialization, which is managing recovery after large disasters. And the question I've been pondering for the last 6 weeks while being locked up here is, are there any relevant lessons for this situation from what we know about managing recovery after large disasters? So to answer that, I'm going to have to start with an extremely condensed view of how I and my colleagues see disaster recovery working, and then we'll get into how the current situation may or may not be similar to that. So first, a natural disaster, what a natural disaster does is it disrupts the functions of the city. And usually it does this by suddenly breaking all the hardware, the infrastructure, the buildings, et cetera, that make those functions of the city work. And to restore the functions, we need to replace all the hardware, and we need to replace it really quickly, much more rapidly than in normal times. And that process of rebuilding the city, it's like all the things we know about normal city building with all the complexities and controversies, but with one difference, which is that the process of rebuilding happens in compressed time. And it turns out that's that's the one thing that's different, and it's a really key difference. And that's what makes post-disaster recovery a really different decision environment than we're normally used to operating in. Especially because some things, especially things related to flows of information and money, compress differently than others. And so it makes everything is out of sync. And it's a very different situation to operate in. So how does this differ from how things normally operate? Well, in my view, cities are self-organizing systems of multiple actors, organizations of organizations at various scales. There's no czar in charge of building cities. And so sometimes we think we need one after a disaster, and we don't. That's not how we do things normally. Cities are built from the bottom up, and they recover from disasters from the bottom up. Which is not to say that government isn't important. Government is one of the actors. It's an important actor, not the only one. Government can represent the collective will. It regulates the process. It creates the rules. And importantly, it can provide resources in the form of money and technical guidance. But it turns out in compressed time, government and bureaucracy are poorly suited to operate in that environment. They don't work fast enough. And so relative to city building in normal times, recovery activities especially come differentially, much more so from the bottom up. And also we see new organizations emerge to fill gaps that bureaucratic government agencies can't provide. So the other really key feature of post-disaster recovery is that there's this constant tension between being fast and being smart. And so the question that we ask in recovery is, how can we help recovery to be both fast, and inherently it wants to be fast, but how can we help it be both fast and also smart at that high speed? And the answer is to widen the bandwidths of information flows. So thinking of all these many actors acting in compressed time, they can be a lot smarter, and if we feed them more information, if they know what each other is doing, they can self-coordinate. And so we need a lot more information because of the scaling problem. We need a lot more information flows than in normal times to feed all these multiple interactions that are going on at high speed. We sometimes think of it as pushing nutrients out into the ecosystem of builders, whatever metaphor you want to use. And we need a lot more of these nutrients than in normal times because of compressed time. So there's a whole lot of ways to do this, which I'm not going to go into. It includes things in cyberspace, expanding local planning services, creating coordinating information sharing groups, and so on. So this quick compressed time summary of how disaster recovery works. So the question is, in what ways does this recovery model have any relevance to the pandemic? You know, does it apply? And the answer, of course, is yes and no. And so quickly, you know, I think it's good to remind ourselves why this pandemic is really unusual, and it really is something we haven't had experience with, certainly not in modern times. And it's really different than the natural disasters we're used to for at least 5 reasons I can think of. The first one is that this disaster is all entirely economic and social. That's always that's always ultimately what's important about disaster, but here it's all economic and social, and physical rebuilding isn't a part of it. So planners don't play the same type of role that we're used to playing. Secondly, which I think is really interesting, is that this deadly hazard that threatens us is not some external thing. It's carried by other people. The hazard's all around us all the time. And when we think about hazard mitigation, we usually think of protecting ourselves, avoiding hazardous places or against some hazardous other thing. In this case, hazard mitigation means avoiding other human beings. Every person but me is a toxic threat to me. So this idea of the hazard being all around us leads to the third feature, which is this process is ongoing, it's everywhere, the threat is everywhere. So it means we have an unusual opportunity to mitigate while it's going on, which usually we don't. We have to mitigate beforehand and then it strikes us. But conversely, this leads to feature number 4, which is that this disaster unfolds exponentially, which actually our brains aren't wired to understand this at all. And also it begins invisibly. And so it's so we delude ourselves into thinking that we have a lot of time, but we don't. And so this mitigation thing is kind of interesting. On the one hand, we actually do have the opportunity, we have some time to mitigate while it's happening, but we don't have as much time as we think. And this has been what we've been continuing to struggle with. And we'll call this exponential time compression. And I think the fifth thing that's really unique about this is it's at a global scale, unlike any other, even the most catastrophic of catastrophic disasters. This one is at a global scale, which means that we're used to every time any disaster, there's always some external help. And we can't seek this outside help. We have to do it ourselves. And so, given all of this, and that we just said we have to do this all ourselves, what is it that we need to do? And are there any insights we can draw from post-disaster recovery? And to me, I think the one key area that we can draw insight is the idea of governance under time compression. So we're entering into this long period, who knows how long, until there's a vaccine. And we need some kind of a governance model to manage this process that's going to involve selective strategic testing, tracking of individuals, rolling shutdowns for hotspots, and then importantly, as I think many of us have talked about today, aid for affected businesses, aid for affected employees to take care of everybody who's being affected by this. And so this kind of governance system, it needs to be able to act quickly, it needs to be nimble, it needs to be able to improvise while also being smart while this is going on. It also requires broad stakeholder representation, exchange of ideas and innovation, lots of collaboration, and then in the end, prompt and timely decisions backed by data and analysis. And it also importantly needs transparency, monitoring, oversight, as well as the ability and willingness to change course and to make refinements as needed. So I think this governance ideally should happen at the state level. In some cases, large municipalities might be the appropriate place. And I think given what we sort of thinking about, again, this model from post-disaster recovery, I'd like to see states supported by federal resources, that's important, but what they need to do is to support the self-organizing systems of the community. And we've seen some examples here. Samina talked about it, food distribution. Laura talked about it, self-organization in Indian country. We need to support these self-organizing systems, which would be networks of local NGOs, local governments, business associations, community groups, who can all coordinate with each other and share intelligence about all the ways in which we can stay safe and activate the economy and also reach every member of the community. A good model for doing this is something that we see actually in successful recovery governance. Some kind of multi-stakeholder body, and that's important how that's selected. supported by professional staff, data analysis and monitoring so they can track things as they're going along, and which is answerable directly to the governor, but also subject to legislative oversight. And a lot of examples of this exist. I won't go into, but there's a lot of examples both here in the US and particularly in Asia after really large disasters. And I think where you can have this kind of model where it can be smart and it can be nimble and it can and operate at the highest levels of government. Notably, last week here in California, Governor Newsom appointed a broadly representative 80-person task force to do something like this. Now, I think we'll see how it goes. That 80 sounds a little big to me. They had a nice representative list. They published it, the list of everybody, which was good. I think though this is on the right track. It's a good step. Again, we'll have to see how it goes. But to me, this is the right direction and the right kind of model. I also really like these self-organized consortia of states. There's one in the Northeast, one in the West. I think one has popped up in the Midwest. There was rumors this week of one Republican governors in the South. But this, I think this sort of self-organized consortia, again, is sort of consistent with the model of self-organized mutual collaboration. So that's kind of the overview of things. And if I do have a little bit of time. I just wanted to take another minute or so to make some quick comments on inequality and social vulnerability, which most of you have talked about. And I think this is most of what we're concerned about. And so, I think we know that disasters, as Jeffrey certainly reminded us, that disasters present openings for change. And I think we all know that this is clearly a highly appropriate time to address a lot of inequality and inequities in our system. We want the society that emerges should be more resilient and should more effectively serve the needs of everybody. And I don't think I need to belabor this point. So the question that I can maybe address here is, do we, on a sort of a general scale, what do we know from other disasters? What do they tell us? Do they, in fact, catalyze great social changes? Do they even lead to urban planning improvements? And the answer is sometimes, but not usually. What we usually observe after large disasters is, out of all the destruction, some things usually change for the better, but most things usually stay the same. On a physical scale, some parts of cities are rebuilt better. Sometimes there are governance improvements, and occasionally, very rarely, disasters lead to really large scale and significant social changes. And the problem is, I've periodically I've looked through this stuff, and there doesn't seem to be any magic formula for, what are the ingredients for when these, when they really do lead to significant changes. And so we really can't say whether this is going to be one of those rare cases. But I guess what I can say is, it doesn't hurt to try. And I think we heard some good things here today. And I'm cautiously optimistic. There's some unique aspects this time, I think. This affected the whole world, so we're all seeing similar phenomena. It's certainly hard to ignore all the inequities. We know disasters make things more visible. That's one thing that they do. That surely is happening here. It's also, I think, revealed especially the primacy to our society of healthcare, food, and shelter, as many people have said, that those are the fundamental things. And sometimes we stray off into paying attention to a lot of other things, but we really need to make sure that everybody has healthcare, food, and shelter. And I think also, I don't know, maybe I'm naively optimistic, but it seems to me that reality, based on observations of the real world and not alternative facts, has been gaining some credibility these days, because we can see measurable results, and I'm hopeful that that might continue. And it is easier to see how we're all connected, including the 1%, some of whom have been, giving philanthropically, and we could use more of that. So I have to conclude by saying I think some real change is possible. It's not going to happen all by itself unless we all work at it, and we should all keep doing what we do. And that's it. And thank you, everybody. And I really enjoyed what everybody else had to contribute here as well.
Well, thank you, Rob, and thank you, all of you, for very important and insightful comments. We have about 15 minutes for a couple questions at least, and I will pose the first one that came up somewhat early in the discussion. Although it's directed towards Jeffrey and Samina, I think that all of you may have some, kind of sights or reflection on it. And then if there are another couple questions that people want to pose in the chat, we can ask them, and we'll just get as far as, do as many as we can. So the first question, there's a real risk that the pandemic will lead to more exclusion, isolation, and deprivation through zoning for lower densities, lower investments in transit, and through the introduction of local regulations that are expensive to comply with. How can planning policy deal with this? And what is the role of planning education and research in this context? And this is certainly what the planning topic seems to me to be getting the most, popular media attention. Are we going to be scared of density? Are we scared of cities? Are we going to be scared of each other as the real threat? And how should we address that as planners? So, Jeffrey or Samina, do you want to take a first stab?
I'll take a stab at it. I think one thing that we know as planning educators, at least that we teach, is that the more people impacted by a policy or a plan are engaged in that process, particularly at the level of equals when it comes to decision making, the more likely we are to have outcomes that are close to what they desire. I'm sure Samina can speak to that, and also in terms of what she has seen on the ground. So, I think armed with the proper data and analysis, I really think, what can planners control, right? I think that the question should be, as planners, what can we control? And I think, we're at an opportunity, we have an opportune moment here to take advantage of the pandemic having affected everyone, to emphasize human care here and making sure that the most vulnerable are at the table in the decision making process, which if planners assert themselves in a way that they haven't done and more ordinarily, that could be taken care of. So I think many planners know. It's just about taking the opportunity, I think, to be persuasive and really push for the better alternatives that would be against the status, that would be something other than the status quo.
Samina, we can't hear you.
Can you hear me now?
Yes.
It's a great question. And I guess I would say that as planners, we should really be looking to the evidence. So what are the countries that have had a successful COVID response, and what are their densities? And the casual nature with which the word density is being thrown around is a little bit concerning to me. Are we talking about density at neighborhood levels? Are we talking at density of entire cities? What's the scale at which we're talking about? And are we conflating density with other problems? For example, if we're talking about informal settlements where there is no ventilation, not even a wall for a home, is it a question of density, or is it a question of poor housing structure? So I just think we don't have the evidence really to answer the question about the role of density. What we can do as planners is to help unpack for non-planners how complicated that term is and how much is compounded and wrapped up in that. So I think we all ought to be writing editorials, not having a defensive reaction to questions of density, but to have a fuller reaction to questions of density and helping people understand how complex it is. So I think I will leave it at that. I just don't think we have evidence to show that that's what's really driving all of this. And then the second piece to that is, the definitional, and first is definitional and unpack complexity. The second is, let's not allow people to deflect attention from real problems to symptomatic things like density. So in some cases, density may be the problem. In some cases, it might be symptomatic. Let's consider the possibility of universal health care and healthcare clinics, community healthcare clinics in every neighborhood in the United States. Would we then be worried about density? Or are we really using certain markers as a proxy from not having deeper conversations about health infrastructure? We should all be arguing for universal healthcare and health infrastructure and not allowing the conversation to go to really daft, symptomatic explanations for what's going on. Sorry, this gets me riled up. Back to you, Rania.
Can I add something in the context of homelessness? I think it really underscores that focusing on density, I just think it's not going to get us very far for all of the reasons that Samina was just saying. But when we look at what really makes COVID a death sentence for so many people, it's underlying health conditions. And that is fundamentally about poverty, access to healthcare, disparities in healthcare treatment. That has nothing to do with the active density. In the homelessness world, the recommendation is to get everyone into hotels and single occupancy rooms. Now, that's obviously very dense, but the concern is that if you are having people in congregate shelters, it's not necessarily the density, it's viral load and air spaces. But really, the big thing is everyone touching the same faucet and using the same bathrooms and showers. You know, the camps that we're trying to serve where people are just living on the street still, the push is to get tents 6 to 12 feet apart, to get bottled water delivered to everyone's tents. It's actually easier to serve food to people in those circumstances. So I think we have to be very, very careful when we're talking about density for all of the reasons that Samina is saying. And I feel like it gives us the opportunity to escape from, to go back into like our infrastructure planning hole, right? And to not actually confront what are the underlying issues within this.
I wanted to speak to that as well, because if you actually look at the land tenure situation on Navajo Nation, some spaces are not that dense. Like if you look at the spatial attributes, they're not that dense, but in terms of land tenure, families are living like maybe, I don't know, a mile apart, or, you know, it's low density, but the kinship network aspect of that, people are in touch with each other. Or you have households, indigenous households, and it's the entire extended family, but maybe it's a house out in a rural area. So like, I don't know, that's like another maybe aspect to think about when we're talking about density.
Yeah.
Well, let me add a couple of items here. I think that what's the kinds of conversations that we're having now is definitely what we need to be having in the academy. But beyond that, the conversations engaging in planning professionals, where are our planning, where are our comrades in the struggle on this, I think is really important as well. The planners, there's an op-ed coming out fairly recently, to Samina's point, that we should be writing op-eds and engaged in the discussion. I do know that the planners network the editorial board for Progressive City, the online publication of Planners Network, will have a response out soon, or at least let me call it an opinion as to where planners should go, because it seems as though, and it is a scale issue. I think it seems as though what we're hearing so far, planning is not really in the discussion in terms of solution.
Okay. Good night. Hello, I'm Joyce Ann Presley. Thank you, each of you, for your presentations. I've well enjoyed them. I feel much more informed. I live in a state that has a double whammy. We have COVID, and also we've had, in the past 2 weeks, we've had 3 tornadoes. So the problem, and in one of those tornadoes, a family showed up to the shelter without mask, and they were turned away in the middle of a tornado. So it seems that somehow or another, our discussion of values and our practice has to mesh with an understanding of procedure. And just to add one more point, and really more of my question is about rebuilding. When you start to think about procedures and how long it takes for things to get approved and built and whatever, what can planning do to improve procedures and to make those procedures more equitable and more value laden? Thank you.
And as we, thank you, Joyce, for that. And as we are going to have to be wrapping up, and so I will say that I'd like to give every speaker a moment to reflect on anything they would like to, including Joyce's question and comments, and perhaps we'll just go in reverse order. And so Rob, if you would like to start, like we'll go Rob, Shannon, Samina, Jeffrey, Laura, and Marisa. Is any last comments you would like to make or reflections?
I don't think I have too much to add. I did appreciate this final discussion here about density, which I think is something we should keep talking about, because that's what people are going to be throwing at us, and it's a distraction from all the other real issues. And otherwise, just with what I ended with, which is we just need to all keep doing what we do. And I think some of the things that people talked about here in terms of food systems and vulnerability and inequities and homeless, we just need to keep working at it. And anyway, that's it. Thanks.
Shannon?
I was just going to kind of repeat something that Rob mentioned, and that also writes a lot about, that I have found really a good reminder during disaster times, which is that disasters just magnify and accelerate existing processes that are already in place. And so we usually see a widening of inequalities, and but also the opportunity to move forward ahead quickly in some cases. And so, kind of responding Joyce's question, but not explicitly, there are often things that cities do in a post-disaster situation in terms of expedited permitting and moratoria on building permits and things like that are very, mundane and regulatory, but can be important for allowing things to move quickly. I think the risk is often that they do it without public input, and that there are people out there kind of predatorily waiting for those opportunities to advance agendas that wouldn't otherwise make it through a public process, and that we have to be cautious about that. And so I think as we start to try to recover, we need to be aware of those predatory interests that may be trying to take advantage of and exacerbate some of the damage to the populations that we're very concerned about. And so we need to try to insist on public processes, truly participatory processes that are inclusive and transparent, find ways to do them more rapidly, even if that means finding ways virtually, which I think, there's some promise for some of the technology. It's not going to replace face-to-face engagement, but in some ways it may make it more accessible, at least in a temporary way, for people to engage in a way that is safe and meets their needs, because it may be more flexible with schedule and things like that. So we have to be both, I think, on heightened alert for both opportunities as well as exploitation as we move forward. So I'll stop there.
And Samina?
I think my last reflection would be about encouraging, this is a note to self as much as to colleagues, to really look outside of the United States for examples of how work ought to be done. So I'm going to point, and how it ought not to be done too sometimes, but I'll point you to southern part of India, which is a state called Kerala, where local governments and states have done an incredible, the state of Kerala has done an incredible job of managing COVID with very low technology, really excellent. And one of their successes is explained by extensive public health infrastructure. So we ought to look at other places, and also for bad examples. Kashmir, which is also where I work, has been under a lockdown since August 5th. Not because of COVID, but because of mass incarceration under a militarized regime. So I think we ought to look outside of the United States sometimes for examples of what works and what are some dangers. And I see that people are spelling those places. Yes, that's all. Thank you.
Jeffrey?
Yeah, let me piggyback on what Samina just mentioned. You know, cross-national comparison here, I think, is really important in the midst of a pandemic, a global pandemic. With an understanding, actually, the political economy that we're having to work with or within, I think matters as well. In many of these other places, they have planning at the state level. At the federal level, and we do not. And I think that has to factor also into the equation as we kind of think about planning, because I do believe that we are, we train planners to be visionaries for the future in city building, and particularly dealing with what happens in place. Planning happens in places. And so how do we move forward with planning, particularly with regards to social justice, raising human care amongst people of color, lower income, Black and brown people in particular? I think it calls for planning to use this as an opportunity to really move away from trying to satisfy the market and focus on meeting the needs of the most vulnerable. That's at the root, and that's where we need to go.
Thank you. And Laura?
Yeah, so my thoughts really go to the idea of land tenure and development. I feel like it really needs to be central and have a place in planning education. So, I know that we're all teaching land use, politics of land. I feel like it should be in there so that people have a good grasp of what land tenure in Indian country means, and the barriers and opportunities for development and the kind of development that tribes need to see. So in thinking about Navajo Nation, they have 13 grocery stores. So people are having to go to border towns, and they're having to expose themselves because they don't have like what they need in their community. I agree with what everybody else says, that crisis brings what's already there into sharper relief, but I'm thinking in terms of planning. With healthcare, like really thinking again on like the distance and thinking of catchment areas for grocery stores, for healthcare, thinking about the digital divide. But the other thing is, this goes back to the CARE Act, that the US Treasury is still trying to figure out a mechanism of how to get money to tribes because they've never had to deal with tribes. They don't understand tribes. And I feel like that is still part of like the education aspect of the work that we do. Like, how can we really begin to educate folks about how tribes operate and function? And finally, this idea that, you know, I brought this up before about capitalism and alternative economies, and Indian Land Tenure Foundation has been talking about this, but it's the idea of raising capital among tribal nations in the form of bonds, so that, and they're not for-profit bonds, but the sort of like social investments, so that other tribes can get the capital that they need to do the development that they need and not have to go into a predatory market. So those are some of the things that I've been thinking on. Thanks.
Marisa?
So I just wanted to close with something that I don't think we touched on today, which is the particular needs for immigrant and particularly undocumented immigrant communities. And I think we sometimes forget that there are immigrants and undocumented immigrants in every kind of racial and national group that's represented in our country. So this is not merely a Latino or Mexican-American issue, but actually goes across all of our ethnic and racial groups in the country. The government has made very, very profound decisions in relationship to who is going to be able to access money and relief. And so making sure as local planners, we're really building that kind of equity analysis into the work that we're doing, not being able to access the kind of federal or even potentially state resources to serve these populations. In some case, if you're merely married to somebody who is from an immigrant background, you may be denied services. So I think that that's something that's really important to put front and center. And then of course, I think we can't stop thinking about our role as land use planners in allowing the rise of the camps along the borders, really thinking about our county lands and how they're regulated. We have no idea right now how many people who are in these camps or in prisons are in fact actually suffering from COVID and the most extreme issues related to that. So our in-prison populations are also populations that I think as planners, we cannot abdicate responsibility for.
Well, and I just want to thank all of you, and I want to invite everybody to unmute yourselves now and join me in thanking all 6 of you for these, you know, really, really important comments or, you know, thoughts and analysis, and really helping us all think through how we go forward and what we do now. So,
thank you.
Thank you.
Thank you.
Thank you so
Everyone.
much.
thank you.
Thank you.
Thank you very much.
Bye.
Thank you.
Thank you.
Thank you. From Chicago.